Hey guys, welcome back to the channel. I'm Dr. Dustin, a board certified dermatologist, and today we're going to be talking about how to get clear skin if you have blackheads and whiteheads. We call this comedonal acne in the dermatology world, and it's probably the most common type of acne that people experience. Although it can be seen at any age, comedonal acne is most common in the teenage years, and we usually see this in younger teenagers before they might go on to get more inflammatory acne that has pustules and cysts. Last week on the channel we talked about fungal acne, and you can always review that video. Sometimes that may appear like comedonal acne, but certainly has some different features to be aware of. So what exactly are comedones? Comedones is the medical term for blackheads and whiteheads, and what happens is dead skin cells and oil start to plug up your oil glands, your follicles. And when that happens, they can't get out, and the oil builds up underneath. And when that is covered by skin, we call it a whitehead because the pore is still closed and that material builds up and you see that little whitehead. If you pick on them, you can get that material to express. Now, as the material continues to build up, the pore will eventually open, and when that oil is exposed to the air, it oxidizes, it turns dark, and that's when we get blackheads. So essentially, blackheads and whiteheads are going through the same process, but blackheads just have opened up and been exposed to air, but it's the same type of acne, and the treatment goals are going to be similar. Now, like I mentioned, comedonal acne is most commonly seen in teenagers, but it can be seen in all ages. Now, you don't always start with comedonal acne and then go on to inflammatory acne. You may just start with inflammatory acne, or if you get a pustule, it doesn't mean that it started as a comedone. And so acne can evolve in different ways, but comedonal acne is the most common thing that we see, and it's the most common type of acne that you can successfully treat over the counter. We're going to talk about some of those treatments that you can use to get clear skin and hopefully not have to go see a dermatologist like we've talked about elsewhere on this channel. One of the goals that I have is to save you money so you don't have to go see a dermatologist. You can take as much ownership for your own health as possible, and that will include skincare, but other things you can do to stay healthy. Now, where do we commonly see comedones? Now, they can appear anywhere on the face, but it's really common to see them on the nose, on the chin, or the forehead. This is the T-zone, and it's where we have the most active oil glands. It's of course going to be more common if you have a strong family history of acne or you have really oily skin. Because we're not dealing with a ton of inflammation with comedonal acne, you can successfully treat this over the counter, and we're going to walk through some of those treatments now. The first category of treatment, and we'll give you some specific brand names that are available down in the video description if you want to look up some of these products, but the first category are those products that contain benzoyl peroxide. Benzoyl peroxide is one of the most common ingredients used to treat acne, and it's widely available over the counter in both washes, creams, gels, so you can have it as a product that you put on and then wash off, or it can be a leave-on treatment. Benzoyl peroxide has a couple of caveats to be aware of. For one, it can be irritating. If you're using a higher percentage, you might notice more dryness and irritation. So if you have a benzoyl peroxide spot treatment product that's 10% or so, you're probably going to want to just use that as a spot treatment on the specific acne bumps. If it's a lower percentage, you might be able to tolerate putting that all over the face. Now, the studies have shown that 2.5%, 4%, 10% benzoyl peroxide all tend to work about the same. However, those higher percentages do carry more risk of dryness and irritation. But that isn't the case for everybody, and so you want to find a product that will work for you. Another important thing to be aware of with benzoyl peroxide is that it is a peroxide and it can bleach fabric. And if you've ever used it and then putting on your favorite sweatshirt and it starts to turn it orange, or you're using towels to dry your face and you didn't completely get it off, you're going to notice the towel starts to bleach and turn a little bit orangish. So that's something to be aware of. If you're using benzoyl peroxide, you may want to use old towels when drying your face after the shower, or have old pillowcases because it can start to bleach and destroy everything. A couple of types of benzoyl peroxide wash that I really like is the CeraVe Acne Control Cleanser. This is a foaming benzoyl peroxide cleanser. It's a 4% cleanser, and with CeraVe's technology, with ceramides and MVE technology, it's going to be one of the less irritating forms of a benzoyl peroxide that you can get. Another brand that's hugely popular is Panoxyl. Panoxyl makes a great wash that I often recommend to my patients as well, and these are both going to be linked down in the video description. Proactiv is a line that a lot of people are aware of, and the early forms of Proactiv relied heavily on benzoyl peroxide. Many of their products still use benzoyl peroxide, but they have started to incorporate things like salicylic acid or adapalene, and we're going to touch on those here shortly. For your spot treatment or all over treatment benzoyl peroxides, the Persigel is really popular over the counter, and then Neutrogena also makes a really good one that I recommend often to my patients who are looking for a non-irritating over the counter option. That Neutrogena product is called the Stubborn Acne AM treatment, and it's really widely available on Amazon or Target or pretty much anywhere you could buy those types of acne products. The next category of medication that is really good for comedonal acne is going to be salicylic acid. Just like benzoyl peroxide, salicylic acid is available in wash formulations, but it's also available in gels or spot treatments, and unlike most benzoyl peroxide products, it's also available in pads. I just don't see people making a lot of pads with benzoyl peroxide. I think they'd be messy and they'd bleach and stain everything, but salicylic acid is widely available in pads that you can wipe down, and this is a product that I sell a lot in my clinic, especially for athletes or people who have extracurricular activities where they want to keep that in their bag, and if they maybe can't shower right away after practice, they can wipe down quickly with salicylic acid or glycolic acid and be able to help get rid of some of that excess oil on the skin, the sweat, the dirt, whatever they've exposed themselves to. Let's first start with washes. Again, CeraVe has a great acne control wash. This is going to be a 2% salicylic acid based wash. If that's a little drying or irritating for you, you can use CeraVe SA. This has a lower percentage of salicylic acid. It's actually low enough that they don't disclose the percent on the bottle, so I think it's under 0.5%, but it would still provide some efficacy for acne, especially if you have very sensitive skin. Like all CeraVe products, they do have, again, ceramides and MVE technology, sometimes hyaluronic acid, so they're going to be hydrating and tend to be less irritating than generic products. Neutrogena also makes some good salicylic acid washes. These are going to be the ones in the orange bottle. You can find them at most drugstores. And Neutrogena makes a body wash with salicylic acid. Dove Men Care Plus also makes one with salicylic acid. So if you're experiencing body acne, that's usually not going to be comedonal acne, but just so that you're aware, body products are available as well to help treat acne that doesn't occur just on the face. When it comes to spot treatments with salicylic acid, again, this is where I really like CeraVe. CeraVe has a really nice salicylic spot treatment that you can apply directly to the spots as they pop up. One of the other advantages of salicylic acid is that if you have really oily skin, it is going to do a better job of getting through some of that oil, because beta hydroxy acids is just one of the properties that they have, is to be able to cut through some of that excess oil on the skin. So that's something to be aware of. Now, also in the salicylic acid category, you can find products from Bliss or Clean and Clear or Clinique. They all have their own, and you want to experiment and find the one that works best for you. I most commonly recommend CeraVe just because it tends to work well for my patients with less risk of irritation. Now, as I mentioned, there's also other formulations of salicylic acid like toners or pads, and this is where the Paula's Choice BHA toner is really a cult favorite, and it comes in the grayish bottle, and you can put that on a cotton pad or a cotton round and wipe down. You could make a whole bunch of them and keep them in a plastic baggie in your gym bag if you want to make your own pads and you don't want to carry around the full bottle. So you can really be flexible and be creative when it comes to treating your acne, and I do recommend wiping down after practice or games if you can't shower right away. We've talked about benzoyl peroxide and salicylic acid. Now, in general, we're going to talk about alpha hydroxy acids, and these are usually going to be things like glycolic acid or lactic acid, and there are different ways to exfoliate the skin, but glycolic acid in particular tends to do a really good job on acne. Paula's Choice, again, Drunk Elephant, and even The Ordinary all have options when it comes to glycolic acid toners or solutions to wipe down on the skin and provide exfoliation. Anytime you're doing a chemical exfoliation, however, you do have to be aware of the risk of irritation, so I recommend starting slow, only maybe twice a week, and you can build up from there. If you're using a lot of other treatments like benzoyl peroxide or adapalene, which we're going to talk about soon, you may not want to do all of them on the same day, but find the routine that works best for you. You can kind of do a little experimentation and skin cycling and get in a routine that's going to help you to achieve clear skin. One of the most effective things to help treat comedonal acne is going to be retinol. So retinol is widely available over the counter, but my favorite one for comedonal acne is adapalene. Adapalene was previously only known as the brand name of Differin, and it was a 0.1% or a 0.3% available by prescription. But a few years ago, the 0.1% version became available over the counter, and you can still buy that under the brand name of Differin, but La Roche-Posay also makes one that is that 0.1% adapalene. The way that a retinol works is it helps to normalize the maturation of your skin cells, and so when they start from the bottom layer and they grow up to the top where they become dead skin cells and fall off, it helps to make that process happen more naturally so that your skin cells don't stick together too long and plug up those pores. The best way to use a retinol is to wash your face at night and then make sure that you're completely dry. So pat dry your face, and then you're going to take a pea-sized amount of that retinol, and that's enough to cover your whole face. I recommend that you then dot your forehead, chin, cheeks, and nose and rub that in. Just be careful you don't get too close to your eyes or the corners of your nose or the corner of your mouth, because those are the areas that are more likely to experience irritation or retinoid dermatitis. Also, if you're going to be using adapalene or you're going to be using other exfoliants that we've already talked about, it's a really good idea to have a good moisturizer on hand to help repair the skin barrier. So you can find a good non-comedogenic moisturizer so that it's not going to plug up your pores and make the problem worse that we're trying to solve by using these products. I want to offer a few more tips on having a successful treatment course if you have blackheads and whiteheads. So if you're using an active cleanser, something with benzoyl peroxide or salicylic acid, typically you're only going to need to use that one time a day. But you should wash your face twice a day, so make sure you also have on hand a gentle cleanser, something that doesn't have the active ingredient in it, but will also help to remove any excess dirt, oil, makeup, sunscreen, whatever you might have on your face. So you can choose to wash in the morning or the evening with your active cleanser, and then just use a hydrating, gentle cleanser at the other time of day. If you're battling acne, it's important to be consistent with your treatment. If you only put on your topical products once a week or once a month, you're not likely to see success in your comedonal acne treatment. So consistency is key. I would also recommend that you avoid touching your face throughout the day. We all have a habit of touching our face, and we do it a lot more than we think that we really do. So make a conscious effort not to touch your face, because your hands are typically not as clean. We're always doing stuff, and you can transfer excess bacteria and things to your face, and it could make your acne worse. I recommend that you get enough sleep. When you're stressed, you're more likely to experience inflammation and acne due to higher cortisol levels. So getting in a consistent sleep routine is also very important when treating acne. Always remove makeup or sunscreen before going to bed. If you're sleeping in your makeup 2 to 3 times a week, you're not likely to get clear skin. And lastly, I do recommend eating a healthy diet. We'll have other videos on the channel where we're going to talk more in depth about diet and acne, but in general, skim milk can make acne worse for some people, and high glycemic index foods, or foods that are processed, have a lot of sugars, things like that. They'll spike your blood sugar, they'll raise your insulin levels, and increase your risk for acne. Now, if you have blackheads and whiteheads, you need to stick with that treatment for 6 to 8 weeks before you start switching and trying lots of new products. If you've tried a regimen a couple of times, or maybe made some variations, and you're still not getting the clear skin that you want, that would be an appropriate time to go and see a board-certified dermatologist, where we could get you a stronger retinol, or we could incorporate any other treatments that might help you to get rid of that comedonal acne. You can find a dermatologist in your area by going to findaderm.org. I'm going to put that down in the video description as well. Now, the next topic that we're going to cover on the channel is going to be inflammatory acne, which is kind of the next stage of evolution when it comes to acne. So hit the subscribe button, ring that notification bell, so when the next video publishes, you'll get an alert and you'll be able to keep on top of your acne and maintain clear skin. Thanks for watching, and I'll see you guys on the next video.